People who are socially and geographically isolated are more likely to call for an ambulance if they feel unwell or anxious. Increasingly, the NHS is turning to social enterprises such as Focus Independent Adult Social Work, which supports people to remain in their own home and stay involved in their local community. Ed Baran has more.
A large number of people in North East Lincolnshire consider themselves lonely and isolated. As such, they're more likely to be without access to proper care and resort to expensive and unnecessary ambulance call-outs. This has a direct impact on healthcare services. But Focus Independent Adult Social Work aims to change this cycle by providing an easy route for service users to seek expert advice and support.
Focus is a social enterprise providing all the social work services for North East Lincolnshire, from assessment through to the commissioning of services such as home care, residential care, and enabling people to be more independent in their local community.
Focus is a one-stop shop for all the statutory social work services. Last year it received 43,000 phone calls from public and professionals. 16,000 were from people in need of help. 7 out of 10 of those problems were resolved during the call.
And this is where all those calls come 24 hours a day, 365 days a year to the Focus Response Centre here in Grimsby. People can call up for social care and community health advice and information, and where appropriate are referred to external agencies.
One of the areas Focus prides itself on is the huge strides it's made in the use of technology, helping service users and staff alike.
Within Focus, every member of staff receives what we call an agile kit, and they all get these laptops which are 3G and Wi-Fi enabled, and also some smartphones. And it's this equipment really, I would say, that's enabling us to have a good response and create better outcomes, amongst other things, for our service users.
Focus were among the first in the country to develop a database with integrated health and social care records, allowing employees and healthcare workers instant access anywhere in the community.
So historically, before the integrated care record, we very much run a paper-based system, and we had rows and rows of case files, as most social organisations across the country will relate to. And what we've been able to do really is utilise this integrated care record and its excellent document management system to make everything fully electronic.
Focus also provides an online portal called Services for Me, which gives information on where and how to access various health and social care options, as well as people being able to get online or phone Focus from their homes to seek help. Local GPs may refer individuals for expert advice.
One of the big things as a practicing GP is that patients present into a clinical setting when actually the real problem is their care needs. And working with Focus has made a real difference to how I can address the needs of the patients who are presenting to me. It's transformed the way in which we can meet the needs of our population.
Focus places importance on delivering services to local communities so isolated individuals can access them more easily. It operates an outreach bus that travels to busy local places such as this supermarket car park, so people like 40-year-old Dawn Sharlotte from Grimsby can come for advice and support.
People can access it that wouldn't normally sort of know about the services, with it being sort of in the centre of Grimsby or in the centre of a town. You can actually come onto the bus and have a private conversation, maybe one-to-one.
Giving access to the isolated at the forefront of person-centred technology, improved outcomes for service users. Focus Independent Adult Social Work is at the heart of the community.